placed, and we are going to place some fluoride, and we do this a lot whenever we have any type of provisional placed or even at the cementation. And one of the things we want to introduce you to today is a fluoride that we're using in our practice that we really like a lot. And the indications for the fluoride, which is from Voco, is basically they have several different ways that you can use it. We use it before we do bleaching on patients and after, so we'll apply a little bit of the fluoride after. We'll take patients like Eric who started out in provisionals, and we'll seal the margins with the fluoride just so patients don't have sensitivity. And one of the things that we've started doing now is something that has been very, very effective. One of the things I explain to patients is just because you have a restoration on your tooth doesn't mean that you can't get decay there. And we've seen that. And it's really just a nice added bonus to our patients to say, once we place your final restorations, we're also going to seal the margins, because where are we going to see decay? We're going to see it right where the tooth and the restoration meet, and that's what we're going to do today. One of our favorite ones is the Pro Fluoride, and again, we use it pretty much on a daily basis. And I'm just going to show you how we do that. I'm going to place these retractors in, and just open for me here, Eric, and I'm just going to slip these in, and just so I can really get a good clear. I usually don't place retractors when I'm doing this, but I want you to kind of see where we're doing this. And close down for me. And you can see that we placed veneers pretty much on Eric's upper 8 maxillary arch here. And the Pro Fluoride really, it comes in a little bottle just like this. And you'll notice that it's pretty thick. That's something that I noticed right away. You can shake it. You'll hear a little, almost like a little, I guess, a little ball in there, kind of really mixing that up like fingernail polish, we would say. And one of the things you want to look at is when I take the top off, there's a little tiny hole in there, and you can see that at the very top. And when we're pouring that out, you'll see that that needs to be up, so that way you can get some air to it, so as you're dropping it in the mixing well, it just easily comes out. So I'm just going to kind of come over here to my little mixing well. And again, I'm looking for that little hole, so I'm just going to kind of tip that up and just have it kind of drop out, just like that. Okay. And basically what I'm going to do is take a little brush, and I like these little brushes that come with it because they've got this little pop-up dispenser. And you can see you can refill it just like that, or you can just kind of pop it up just like this. So that's kind of nice to be able to just get one out. So I'm just going to kind of take one of those brushes out of there, and I've got my little mixing well, so I'm going to come back over here to Eric, and I'm going to bend this little brush, and it's very thick. You can see the concentrate. You see how it's kind of sticky? It doesn't drop, and I'm just going to kind of mix this up, and what I'm going to do is just follow all the margins here. I'm going to go all the way around, just like that. And what this is going to do is it's just, again, going to seal any margins. If he has any sensitivity, it's putting that fluoride right in the areas that we need it. And so we're just going to go all the way around. I'll tell you, in our practice, we use a lot of fluoride. We give a lot of fluoride to our patients pretty much with every procedure that we're doing. What I like about it is that we can really just kind of go around all the margins, and you'll see that. And it's clear, so it's not going to, you're not going to see it. It's not going to show up. You doing okay, Eric? So we don't have any of that discoloration, but what this is going to do is really attach itself to that margin. And we're going to really tell Eric that we don't want him to eat or drink. We really don't want him to brush anytime soon, at least for 30 minutes. And this will continue to work. And I'll tell you, we've had so many patients to say, wow, my sensitivity has completely gone away. And I'll do multiple applications, as you can see. We just want to make sure that we've really gotten it on all those restorations. One of the things we did is we're going to allow that to dry for about 15 seconds. There's no curing. And basically, again, just letting the patient know that we don't want them to eat or drink anything for about 30 minutes. I'll tell you, as an adult, a lot of adults don't want to have fluoride treatments. They don't want to have to use the foam trays. They don't want to have to use the foam or the gel. This has really been a great application for us to be able to have patients just understand how easy it can be, but also they also have a unidose that you can send home with your patient if it's someone that has some root sensitivity, maybe is going to do some bleaching at home and wants to make sure that they don't have any of that. So it's a really good contradiction for that. And again, one of the things that I really liked about it was the fact that it is a very thick concentrate, and we've really just had this in every single room now. So anytime a patient complains of sensitivity, or we know we're going to place a provisional, we're ready to place the final, this is the product that we're using.